on all the coding and documentation pieces to make sure we're able to achieve that objective. So those are some of the key points for improving ratings. So far as member interventions are concerned, we have newspaper articles. We just going into next year, we're going to have silver slippers, silver sneakers. The nice little program for our elders, silver slippers. Anyway, silver sneakers. Yes, thank you. So we're going to be pushing that out into the marketplace so that we can get our elders up and moving around and going to their favorite gym and all those sorts of things. So you'll be hearing a lot more about that. We are sending our members gap letters where it looks like, based on our documentation, that they need to come in and be monitored for something or another. So we're sending out those gap letters with reminders. If we can get the doctors to actually collaborate with us so that some of these letters go out with the physician name on them, we actually think that this will actually improve adherence that much more. And increase the likelihood that members who otherwise might not come into a caregiver's office would otherwise come in. So those are some of the member interventions, and we're obviously doing things like this for staff interventions. We're really trying to get out with the caregivers to talk through some of these issues so that we're creating more and more of a partnership. What can you do to reach the stars? Encourage your patients to complete recommended preventative screenings. Talk to the members about physical and mental health, bladder control, and fall risk. Make managing long-term chronic conditions a priority in your practices, and trying to use us as your partner as much as we possibly can. And I think that's it. Thank you. So, any questions? Did I do all right?
You did awesome. You're like
Yeah, Pat?
Is any patient exempt from those screenings, like a metastatic cancer patient? They still have to have their retinal exam every other year? That seems personally.
That's a great question. I don't know. What's the deal on that, Dawn or April or Reba?
On that particular measure, they would not be exempt. Some of the measures.
I'm going to say you're just entering hospice coming to the retinal exam?
We would not push that, but then we would not be measured on that patient. There are patients that we know. We ask that too. I mean, there are some that we just.
I mean, I know you didn't make this up.
Right.
I don't want you to feel like
we take that into consideration.
And the expectation is, even though there are high expectations, there's also the way the measures are set up, there is room for those where they know you're not going to be in compliance. So there is some wiggle room there for those members that you know either couldn't, wouldn't, or shouldn't have the screening, and they factor that into what they consider at the 5-star level versus.
But there really is no formal exemption for anybody.
There is exception for some measures, just not all measures.
Right. I was a crawl physician from 1985 till 2009, and that's when about 30 of us in Bloomington got traded to OSF Healthcare. And so now I work as a family physician with OSF Medical Group.